Welcome and thank you for joining. My name is Solange Patrolio and I'm the Health Educator for Community Health and Atlantic Health System. Today, the webinar, Taking Care of Your Ovarian Health, presented by Dr. Yassine, Ambulatory Chief of Medical Resident at Morristown Medical Center. Before we start, I have a few announcements. This webinar is being recorded. All participants are muted. If you have questions, please use the Q&A button or use the chat for future comments. We will try to get through all questions and end the presentation. Thank you, Doctor.
Thank you, Solange.
The floor is for you.
Just to confirm that you are able to see my first slide. Thank you, Solange, and good afternoon, everyone. My name is Farah Yassine. I'm one of the third-year internal medicine residents at Morristown Medical Center. I'm also the ambulatory chief medical resident for this academic year, and I'm very excited to be talking to you today about taking charge of your ovarian health, especially that September is the Ovarian Cancer Awareness Month. This is a quick outline of my talk today. We will go over the female reproductive system, the impact of ovarian cancer. We will also go over the risk factors, genetics, symptoms, diagnosis, and treatment options. And at the end, we will discuss what steps can we take to reduce the risk of ovarian cancer. Let's start with the anatomy of the female reproductive system shown here, particularly the ovaries. The ovaries are the reproductive glands responsible of producing eggs or ova that are essential for reproduction. These eggs or ova travel from the ovaries through the fallopian tubes into the uterus, where the fertilized egg settles and develops into a fetus. The ovaries are also the main source of the female hormones, estrogen and progesterone. One ovary is on each side of the uterus. As you might know, cancer starts when cells in the body begin to grow out of control. Ovarian cancer, just like other tumors, it is a collection of abnormal and quickly dividing cells, starting in an ovary. But it actually refers to a group of diseases that can originate in the ovaries, fallopian tubes, or even the peritoneum. And the peritoneum is actually the lining of the abdominal cavity. Because these cancers are so closely related in origin and the way they behave, this is why we refer to them all as ovarian cancer. Ovarian cancer is the second most common gynecologic cancer in the United States. We know that endometrial cancer, which is another kind of cancer that targets the lining of the uterus, this is the most common gynecologic cancer. So the second most common is ovarian cancer. And it causes more death than any other cancer of the female reproductive system. Some more statistics from the American Cancer Society that I want to share with you just to show the impact of ovarian cancer that we're dealing with. It is the 7th most common cancer in women, and the estimates in the United States for the year 2024 is that about 20,000 women will receive a new diagnosis of ovarian cancer, and about 1 in 73 will develop ovarian cancer in their lifetime. In terms of death from ovarian cancer, about 12,000 women will die from ovarian cancer, but this is still around 40% less than the numbers that were recorded about 50 years from now in 1975. So this is likely thanks to better treatment options that we will go over towards the end of the talk. We have 3 types of ovarian cancer, and this is because the ovaries are mainly made up of 3 kinds of cells. Each type of cell can develop into a different type of tumor. Epithelial tumors, they start from the cells that cover the outer surface of the ovary, and most of the ovarian tumors are epithelial cell tumors. We have the germ cell tumors that start from the cells that develop into the eggs or ova, and the stromal tumors that start from the structural tissue that holds the ovary together and produces the female hormones that are estrogen and progesterone. Some of these tumors are benign or non-cancerous and they never spread beyond the ovary, but the malignant or cancerous types of tumors, they can spread or metastasize to other parts of the body and can sometimes be fatal. Now, switching gears to talk about the risks of ovarian cancer. Ovarian cancer is most common after menopause, so older age remains a risk factor for most ovarian cancers. All women are at risk, but some women are at a higher risk if they are overweight or obese, if they have had children later in life or never had a full-term pregnancy, if they have received infertility treatment, if they have had prolonged hormone replacement therapy. Also, women tend to be at higher risk if they have had breast cancer before, if they have a family history of ovarian, breast, or colorectal cancer, or if they are smokers. Some genetic mutations, specifically the BRCA1 and BRCA2 genes, also we may hear about them by the term BRCA1 and BRCA2 genes, they confer higher risk of ovarian cancer. And I want to stop and share some more details on these two genes, the BRCA1 and BRCA2, because these are the most common mutations that increase the risk for both ovarian and breast cancer, and for being diagnosed at a younger age compared to the average age of diagnosis in these kinds of cancer. These genetic changes can be inherited from either parent, and mutations in the BRCA1 and BRCA2 genes are 10 times more common in women from Ashkenazi Jewish ancestry. Other mutations in less common genes may also increase risk for ovarian cancer. For example, a very important hereditary genetic risk factor is Lynch syndrome, also known as HNPCC, if you ever hear this term, or hereditary non-polyposis colon cancer. It's a very long name of this syndrome. It can run in families and it increases the risk of several cancers, including colon cancer, ovarian cancer, endometrial cancer. So this is why it's important to know and share your family medical history on both sides of the family. Again, it's mom and dad, and it's an important way to help identify genetic conditions that increase cancer risk. So if you know that one of your family members has one of any of these genetic mutations, it's very important to talk to your primary care doctor or to any of your physicians. Share with them the information that the family has these genetic mutations, as you might need to be checked up earlier than usual. And whether or not you have a family history of cancer, all women diagnosed with ovarian cancer should have access to genetic testing to see if it's a hereditary condition. Knowing that you have a genetic mutation might impact your treatment options. And for other family members who are diagnosed with a hereditary condition, tests to monitor cancer can help reduce the risk. A genetic counselor can help explain the risk for inherited diseases, discuss steps to reduce the risk, or detect the disease early on. Now, talking about the symptoms of ovarian cancer and when should you start worrying about this condition, if you have persistent bloating or swollen tummy, if you have a reduced appetite or feeling full quickly after eating, pain or tenderness in your tummy or pelvis, which is the area between your hips, or sometimes urinary symptoms, such as needing to pee more urgently or more often. But when do these symptoms become troublesome? If they're frequent to you, so usually more than 12 times per month, we're talking. If they're persistent, as if they don't go away, or if they're not normal for you. We know that these symptoms are shared with many other conditions, so this is why you shouldn't be concerned unless they're really persistent, very frequent, and new to you. And if for any reason you are concerned, it's best to get them checked out. Other symptoms may include constipation, diarrhea, pain during intercourse, back pain, fatigue, changes in your menstrual cycle. And as you see, these are symptoms that are common with other conditions and not necessarily specific to ovarian cancer. And this is actually one of the challenges in the diagnosis. Just as you saw, symptoms are very common with other non-cancer causes, but when ovarian cancer is in its early stages, You might not notice any symptoms. Also, other conditions can cause the same symptoms. So this is the big challenge we have. So for these reasons, ovarian cancer is not often diagnosed until after it has begun to spread. You might have heard about screening tests for cancers, and these are tests used to detect cancer before it shows any symptoms. Another challenge with ovarian cancer is that there is no screening test that accurately detects ovarian cancer. You might be familiar with the pap smear. The pap test can only screen for cervical cancer, but not really ovarian cancer. Pelvic exams done usually in your primary physician's office or in your gynecologic office can check for enlarged ovaries and signs of fluid in the abdomen, but sometimes it cannot really screen for the early ovarian tumors when the tumor is still small in size. Women with ovarian cancer may also have high blood levels of a protein called CA125, but it's not really a reliable test because conditions like pregnancy, fibroids, your monthly period can also cause higher than normal blood levels of this protein. So it's not really a reliable way to screen for ovarian cancer. So how do we diagnose ovarian cancer? If cancer is suspected, your doctor will meet with you, will ask you if you're having any symptoms, when they started, and will ask you about your medical history and any history of cancer in your family. They will perform a physical exam, they will order some blood tests, they will also order some imaging tests, such as an ultrasound. They might order scans, like a CAT scan, a PET scan, or an MRI. All these are different types of scans. These tests can show if there's a growth or if there's a tumor, but cannot really tell for sure if it's cancer yet. So a definitive way to diagnose the ovarian cancer is when a biopsy is taken from the mass. And this might involve removing tissue and looking it under a microscope. And the biopsy may be done before a surgery to get the diagnosis or during the surgery when removing a big mass. When ovarian cancer is diagnosed, you might hear the word staging. So what is a stage? Staging describes the extent of cancer in the body. This helps with choosing the best treatment option. Like most cancers, ovarian cancer has 4 main stages. In stage 1, or the early disease, the cancer is in one or both ovaries and might also be on the outer surface of the ovaries or in the fluid in the abdomen. In stage 2, the cancer has started to spread into the fallopian tubes or other organs in the pelvis. Stage 3, that's when the cancer has spread to the lymph nodes or to other places in the belly, such as the lining of the belly, the peritoneum, or the outer surface of the spleen or liver. Stage 4, which is the most worrisome, is when the cancer has spread to lymph nodes outside of the belly, for example, inside the lungs, inside the spleen, liver, or even the brain. There is no one way to treat ovarian cancer that is similar for everyone. The ovarian cancer treatment plan should rather be customized based on the type, the location, the stage of your cancer, your age, whether you plan to have children later on, and your overall health. So every patient will have a different treatment plan for their ovarian cancer. You and your doctor should share decisions about your treatment plan. And you might have on board a gynecologic oncologist whose specialty is to care for women with cancers of the reproductive organs and who might be of the most help in your treatment journey. Surgery is commonly performed for ovarian cancer, and usually the goals of the surgery are to find out the cancer stage, how far it has spread, to remove as much of the tumor as possible, which is called debulking. You might hear this term, which is removing as much of the tumor as we can. And the type of surgery performed will depend on factors such as the cancer location, the type of the tumor, the patient's age. And the surgery might include removing the uterus, one or both ovaries, or one or both of the fallopian tubes. So every patient is different. If you want to have children in the future, ask your doctor if fertility sparing surgery is an option for you, which is removing one of the ovaries, but preserving the uterus and parts of the ovaries that might not be involved with the cancer. And I just want to point out here that if you have a surgery to remove both ovaries before you have entered natural menopause, the surgery will cause you to enter menopause right away. And this is often something we call surgical menopause. And as you might be familiar with, common symptoms of menopause include hot flashes, mood changes, changes in the sexual function, and affecting your bone health. So before you have a surgery, ask your doctor what can be done to treat the symptoms of menopause and protect your bone health. Part of the treatment for ovarian cancer might be chemotherapy or chemo. This is using anti-cancer drugs to destroy cancer cells. And chemotherapy might be given before the surgery to shrink the tumor and make the surgery easier, or after the surgery to kill any remaining cancer cells. Patients with ovarian cancer most often receive combination chemotherapy, that is, 2 or more drugs that can attack the cancer in different ways. It is usually injected into a vein through an IV. In some cases, if the tumor has spread into the belly, there might be other ways of giving the chemotherapy. Sometimes it's called hot chemotherapy or HIPAC, which is bathing your belly with chemotherapy other than giving it via the IV. Other treatment options include hormone therapy, that is using hormones or hormone blocking drugs to kill the cancer. Radiation therapy, it is less commonly used to treat ovarian cancer, but sometimes it could still be used. And this is high energy X-rays directed towards the cancer in order to kill the cancer cells. You might hear about immunotherapy, which is drugs that can boost the body's immune system to kill the cancer. And there's a lot of researchers that are studying how best to use immunotherapy to treat ovarian cancer. You might also hear about targeted therapy, which is drugs that can specifically attack some proteins in the cancer cells. Usually, there are PARP inhibitors, if you ever hear this term. This is one kind of targeted therapy. Your doctors might also choose to put you on maintenance treatment. This is usually a treatment that is used after completing a chemotherapy and could prevent or delay the return of or the recurrence of your cancer based on the surgery findings or specific testing of the tumor. If you're curious about what research it's still undergoing, and if you're interested in clinical trials, these are studies of new drugs or procedures that are done in patients that are volunteered to participate in the research. Usually, these studies test whether new medications are safe and more effective than the existing ones. Your doctor will tell you if any clinical trials are enrolling and if you're a candidate to enroll in any trial to test these drugs. You might be able to get a new treatment for ovarian cancer before it's generally available, but it still is under testing. What about the outlook and prognosis? So, due to the nature of ovarian cancer, every patient may have a different experience. The outlook will depend on many factors, including the stage, as we've just mentioned, and the type of ovarian cancer. It also depends on the age and the overall health. In general, the earlier detection of ovarian cancer means a better outlook. I'm showing you here the survival rates of ovarian cancer, and you can see how survival rates are much higher in the early stages of the disease. Up to 90% survival is over the next 5 years if the ovarian cancer is detected in an early stage, like stage 1, compared to only 20% if it's stage 4 or in the advanced stages. It is very important to have a support system in the battle against ovarian cancer. Most treatments have a lot of side effects. It can affect your body, your emotions, your mental state, let alone the life-changing diagnosis. So it's important to get social and emotional support for your well-being. Consider talking to a counselor or joining a support group to help you through this time. Your healthcare team, friends, family members, and others can help you cope with your emotions and guide you on this journey. There's no magical or miracle drug to prevent cancer. I wish we had, but we can still take some steps to reduce the risk for ovarian cancer. The most important step is following a healthy diet and regular exercise. If you are able to have a child, consider breastfeeding as it is associated with a reduced risk for ovarian cancer. Talk to your doctor if you're interested in taking birth control pills. In some studies, women who took birth control pills for 3 years or more had a reduced risk for their ovarian cancer. If you have genetic risk factors in the family or if you carry a genetic mutation, you might be counseled to think about risk-reducing surgery to remove the ovaries or fallopian tubes before cancer develops. If you have not yet gone through menopause, removing the ovaries will cause early menopause, as we mentioned earlier. So before considering the surgery, talk with your doctor about the side effects of early menopause and what to expect. I'm including here some references. And with this, thank you very much for joining my talk.
We appreciate you joined today, doctor, and we are so grateful that you present today.
Thank you so much. Of course, my pleasure.